This is the list of the most common cancers in children. And I'd like you to go through this one by one and just give us an idea of what's happening here and what we're seeing and the treatment and the possibility of being able to survive. Here we go. We'll start out first of all with acute leukemia. What exactly is acute leukemia? How's it treated?
Sure. Basically, leukemia is a blood of the cancer. Cancer of the blood. So what happened, the blood is originated in the body in an organ called bone marrow. If you crack a bone, there is a red tissue inside it. That is the bone marrow. And this is the mother of all the blood cells. So what happened, in general, our body always proliferate the cells. So you have one cell become two. This has happened all the time. We have in our body a mechanism to clean any mutation. Mutation means abnormal gene, abnormal cell. That's the policing of the body. So if there is a cell that is abnormal, immediately the immune system attack it and die. But when that mechanism fails, this is when cancer happens.
Then we have brain tumors. Brain tumors are everywhere. People say, how can a brain tumor be in a child? Guess what? It happens to everybody at every age.
Right. There is really no specific cancer for children, although we see sometimes more in children than adults. But brain cancer is the second most common cancer in children, and sometimes children are born with cancer, and brain cancer is one of them.
What is a lymphoma and how is it treated?
Lymphoma basically is a cancer of the lymph node. The lymph node has lymphocyte, and if one of these lymph node is abnormal and start growing, then it will cause lymphoma. The lymph node will become big, we come into big masses.
Neuroblastoma, what is it? Why does it almost always affect kids?
Right. Neuroblastoma is very specific for children. It really originates mainly in the adrenal gland or in what we call it the parasympathetic system. And it's a very interesting cancer. We're learning more and more about it, and that learn affecting treatment of other cancer because we call it biologically very active. They can mature from a neuroblastoma to something else to a normal benign tumor.